Brussels, the capital of Belgium, is host to a number of international organizations, including the European Union (EU). The spread of the coronavirus has affected EU activities in Brussels. Just last week, the President of the European Parliament, David Maria Sassoli, announced that the Parliament is closed to the general public for 3 weeks and only core staff will be allowed entry to the premises. According to the World Health Organization, over 100,000 cases of the virus have been recorded, with over 3,000 deaths. The economies of the most affected countries are grounding to a halt, and the search for vaccine to tackle the disease is on. When I left Accra for Brussels for the EU ECR Africa Summit, I was put through checks at the Kotoka International Airport before boarding a flight to Amsterdam. My temperature was checked and the necessary questions were asked. At Schiphol Airport in Amsterdam, no question was asked. I went through the immigration and passport control processes smoothly, so I boarded another flight to Brussels. At the Brussels International Airport, nothing showed that authorities were detecting or screening to check if any passenger had the virus. But already, Belgium had recorded 8 cases. I and the team from Ghana went through the normal process till embassy officials met us at the airport and took us to our hotel. At the hotel, we were told to stay indoors and only go out when and if necessary. I engaged with the 2 Ghanaian colleagues I came with to find out what they made of the process.
Right from Kotoka International Airport, after going through the normal immigration processes by way of filling the immigration forms, after your check-in, I was subjected to an inspection by health team. I suppose they are from the Ministry of Health, first of its kind. In Amsterdam, I was expecting to see something similar or beyond what I saw in Ghana, especially as the virus was a pandemic affecting almost every part of the world.
When I got to Amsterdam, that Schiphol, nothing. I didn't see anything. Switzerland, nothing. I entered Switzerland, went for my program. But all I realized was there was a program behind where I was staying. That everybody was saying, like, there's a program you can attend for the tourists, everybody. But then 2-3 hours time, and I heard it's been cancelled. So I was like, why? They said, oh, they've cancelled event that takes, like about 1,000. So anything that brought about 1,000 people cancelled.
In Brussels, I was told of how nose masks had run out, with people stocking foodstuff in the event of a total lockdown. I engaged 2 residents of Brussels, Martin Apnick, a banker, and Julian Zanki, a journalist, on what their government is doing to manage the spread of the virus.
In all of Belgium, we had 8 cases yesterday.
The whole of Belgium?
The whole of Belgium, 8, and there were a little bit more today announced also.
Is it causing fear and panic among people in Belgium?
Panic is not a word, but they do get a little bit anxious and they get a bit worried. And some of them start to take a bit more food in, just in case that there would be a food shortage. But it's sort of okay still.
One weekend we're expecting to see people wear masks, as in other countries, but we don't see that in Belgium. Is it that people are not worried, they are not scared?
I don't know if they're not scared, but there are no masks to be found in pharmacies right now. It's all sold out.
There's a shortage of masks here in Belgium?
There's a shortage of masks in Belgium.
Because of the virus?
Because of the virus, and there's a shortage of hand sanitizer also because of the virus.
Actually, we don't know nothing about the government, what it's asked to us. I was supposed, as you, to go to a meeting tomorrow at the Commission, and it's been cancelled. I received an email, standard email, and so everything has been, changed, and my program changed. So it's all about cancellations, but about how to act with people you're working with. Actually, we don't know. And there were a few cases in Belgium, but now there are about 10. So the game is changing a bit. But we don't know how to act and how to cope, actually.
Our stay in Belgium was cut short after the EU cancelled the summit upon advice from the World Health Organization. On our way to Accra, we were given a Ghana Health Service health declaration form to fill. we were asked to state the country we visited, the number of days we spent, and if we showed any signs of the virus, which includes cough, sore throat, and headache. On our arrival, we went through another check where temperatures were checked and other relevant questions asked. This resulted in long queues, leaving travelers frustrated.
If there's anything to go by, I'm sure authorities in Ghana have put in place enough measures to check this particular spread of the virus. My name is Sami Biafe.